Welcome back to Sex and Space. I'm Toshi, and today I spoke with Anil Padavatan from GATE, the Global Action for Trans Equality. We had a conversation about all things trans healthcare, what it is, as well as how and why all kinds of people, not just those who are transgender, access services like puberty blockers and hormone replacement therapy. We debunked some common myths and misconceptions about this topic, as well as having a conversation about all the different ways that families can exist in the world. Let's get into the episode. Thank you so much for being with us here today, Anil. I thought I would start off for our listeners who aren't familiar with what GATE is or does, if you could maybe just talk us through what you guys do there.
Sure. So thanks so much for having me here today. It's really great to be talking to you. GATE is a global trans-led advocacy organization, and we work towards justice and equality for trans and gender diverse communities and gender equality for all. We're an international organization, so we've got team members based in different countries around the world. I'm the GATE Health Programs lead, and I'm based in South Africa.
And so the topic today that we are looking at is trans healthcare, and I kind of want to start at the very beginning with that. And for anyone listening who isn't quite clear on what it means to be trans, could you walk us through that, please?
We use the terms trans and gender diverse to refer to a wide range of identities of people whose gender differs from their sex assigned at birth. So when a child is born, someone will look at the child and based on their physical appearance, assigns them as male or female. And for most people, their gender identity aligns to that sex assigned at birth. But for a small number of us, our gender identity is different to the sex that we were assigned. Now, human beings like to divide things into binaries. They like to know, are you male or female? Are you black or white? Are you a Brazil or Argentina football supporter? But gender, like most things in nature, is actually on a spectrum. And so some trans community members do fall into the gender binary of men or women, but others like me are gender diverse and we don't fit into any binary category. Now, trans and gender diverse people have always existed, and so there's a lot of different terms in different cultures around the world, such as hijra, two-spirit people, fa'afafine, and that's why it's really important to always respect the terms that people use to describe themselves.
And so building on from that, when we talk about trans healthcare, what does that mean?
Well, when people talk about trans healthcare, often they're actually referring to gender affirming care. But trans and gender diverse people are human, and like everyone else, we've got a full range of health needs. In fact, because many trans and gender diverse people have fewer economic opportunities, many of our community members are more vulnerable to illnesses that are associated with socioeconomic inequalities, like HIV, tuberculosis, heart disease, asthma, and diabetes. And because of the widespread stigma and discrimination in societies around the world, trans and gender diverse communities face a lot of barriers in accessing just general healthcare. And so a lot of GATE's work actually focuses on access to general healthcare services like HIV services.
And now I want to pick up on something that you said there, which was about gender affirming care. And for anyone listening who maybe has an idea about what that is, but isn't, quite certain on the definition, could you unpack that for us, please?
Okay, so first of all, I am not a doctor. I'm a co-author of the South African Gender Affirming Healthcare Guidelines, but I contributed to the human rights sections, and medical experts wrote the medical sections. So the general information that I'm sharing here today comes from medical guidelines and from medical research, but public safety announcement, if you need specific information for yourself or a loved one, always speak to a qualified healthcare professional who has training and experience in providing gender affirming care. So what is gender affirming care? To look at one definition, the World Professional Association for Transgender Health defines it as safe and effective pathways for achieving lasting personal comfort in their gendered selves in order to maximize their overall health, psychological well-being, and self-fulfillment.
And so can you talk to us about some examples of what gender affirming care might look like?
So it can include hormone replacement therapy, voice and communication therapy, reproductive and sexual health interventions, puberty suppression, endocrinology, hair removal or hair implants, surgical treatments, and also mental health support.
So it's quite a big, broad umbrella term for lots of things that come within that.
Absolutely.
And what are some of the reasons that a person might want to be or need to be accessing gender affirming care?
Accessing gender affirming care is actually a really deeply personal decision, and not all trans and gender diverse people want or need gender affirming care. But for those who do want or need it, it can improve your mental and physical health and just lead to an overall better quality of life. Also, it's important to remember that gender affirming care is more like a menu, it's not like a recipe. You don't go through a series of set steps. So some people might need to access only one type of intervention, like hormone therapy or mental health support, and other people might want or need a whole range of medical interventions. So it really always has to be tailored to the person's individual specific healthcare needs.
And I think one thing that I'd like to highlight at the beginning of the podcast is that gender affirming care is not just for trans people, cisgender people can access it too. And so this is kind of a two-part question. Firstly, what does it mean to be cisgender? And secondly, what are some of the reasons that a cisgendered person might want to or need to access gender affirming care?
So first of all, in terms of the term cisgender, it's just used to make it easier to talk about gender identity in society. So in Latin, trans means moving across, and cis means staying on this side. So cisgender refers to people whose gender identity corresponds to their sex assigned at birth, which is basically the majority of people in society.
And in terms of examples of how cis people are accessing gender affirming care, like sort of what that looks like, because I think sometimes maybe it's not common knowledge, but there are actually, lots of ways in which that is happening. And I think it's quite important that we do highlight those things.
Yes, so if we're defining gender affirming care as interventions aimed at achieving lasting personal comfort in gendered selves in order to maximize overall health, psychological well-being, and self-fulfillment, then definitely there's many medical interventions that cisgender people use that fall into this category, including hormone replacement therapy, hair removal or implants, certain types of surgery. For example, there's a condition called gynecomastia, and that results in increased breast size in men. And this can obviously be very, very distressing for cisgender men. And while it can clear up on its own, it's often treated with medication or surgery. And having these treatment options is very important because everyone wants to feel comfortable in their gendered selves.
And I think another thing that I'd like to discuss is puberty blockers, because, we hear so much about that in the media and there's so much misinformation that floats around. And I wondered if you could explain what puberty blockers are and how they work.
So in very, very simple terms, puberty blockers are drugs that are used to suppress the production of testosterone and estrogen.
Okay.
And that's a big simplification, because the proper name for these drugs is gonadotrophin-releasing hormone agonists.
Wow.
And that's a really long name.
Yeah.
And the explanation of how they work is even longer. But basically, if you remember your high school biology lessons, you'll know that testosterone and estrogen are the so-called sex hormones. They cause the development of secondary sexual characteristics like breasts and beards that appear during adolescence. And these hormones do have other functions in the body as well. But by suppressing the production of these hormones, doctors can basically press the pause button for the development of secondary sexual characteristics during adolescence, although these drugs don't stop other aspects of adolescence development. So, for example, brain development carries on as normal. It's just stopping the development of those secondary sexual characteristics.
And when you say, it's effectively like pressing pause, because I think there's sometimes this belief that puberty blockers can cause, permanent changes that aren't reversible. And I wondered how you might respond to that kind of assumption.
So The whole point of puberty blockers is that it's reversible. And it's really there to provide space and time for young people who are exploring their gender identity to really do that exploration, to work with psychologists and social workers and other healthcare providers, and also to make decisions about what they want to do in terms of their longer term gender affirming care, whether they want to go on to hormone therapy later, or whether they don't want to continue with gender affirming care. So really the whole point of puberty blockers is that it's pausing puberty, it's not cancelling puberty. If you stop using the puberty blockers, puberty continues.
And are there age restrictions when it comes to being able to access those?
Basically, with puberty blockers, the issue isn't age, it's puberty.
Okay.
So we know that puberty starts at different ages for different kids. So if you have trans kids or kids who are questioning their gender identity, there are no medical interventions before puberty. These kids might receive psychotherapy or social support, but there's no medical treatment before puberty.
Yeah.
Once a young person starts puberty and has reached what's called Tanner stage 2 of puberty, that's when puberty blockers can be used. So in the first stage of puberty, there's changes in the brain and hormone system, but very limited physical changes. And then at Tanner stage 2, those physical changes associated with puberty start, like breast growth, hair growth, and so on. And that's when puberty blockers become an option.
Okay.
But because all adolescents develop at different rates, the decision on whether to start puberty blockers or not is always based on the individual young person's needs and also on their specific level of development. So it's not tied to an age, it's tied to someone's development.
So there's no blanket, decision or rule that can be applied to everyone because everyone is so different.
It's very important to remember that the general principle of any medical treatment with children is that all medical treatment needs to be in the best interests of the child. That's the basic principle. And so what will generally happen, obviously this differs from country to country, but what usually happens is that a young trans person will be in the care of a multidisciplinary team of medical experts. It can include an endocrinologist, psychologists, sometimes a social worker, other medical experts depending on the child's needs. And that team will discuss the treatment options, and they'll be working very closely with the young person and their family. So they're going to discuss the treatment options with the parents and guardians and explain the risks and the benefits of the different options so that the teen and the parents and guardians can really make an informed decision about what is in the best interests of that child.
And just going back to what you mentioned about the risks, what are the risks that are involved when, taking something like a puberty blocker?
So it's important to remember for all medication, there are risks and benefits. And for trans adolescents who are experiencing high levels of distress due to the physical changes of puberty, some of the benefits of puberty blockers include that they improve mental wellness, they reduce suicide risk, and they also provide that time and space for young people to explore their gender identity and be in a good position to make decisions about their future gender affirming care, whether they want to continue with gender affirming care or not. But as I said, all drugs have risks. It's what risks exist and what side effects exist really depend on the specific drugs that are used, because there's a range of different puberty blocker drugs. But common side effects include headaches, mood swings, changes in weight and appetite, fatigue, sometimes insomnia, and sometimes muscle pain. There's not a lot of data at the moment about the long-term effects of these medications, and they're used not only for trans adolescents, they're also sometimes used for cisgender children who are experiencing what's called precocious puberty. That's puberty that starts at a very young age and can also be very distressing for younger children. So that puberty blockers are not only used for trans young people, also for young people who at an early age are experiencing puberty. And there are some concerns about potential long-term risks in terms of bone density and in terms of fertility. But at the moment, this is based on theoretical risks, not on data.
Okay.
Because there haven't been a lot of long-term studies, but we also don't have any documented cases of problems with bone density later in life or problems with fertility later in life associated just with the previous use of puberty blockers. But for trans kids, the important thing to remember is puberty blockers are suppressing the production of sperm and ova. So if you start them right at the beginning of puberty and you go straight from using puberty blockers into hormone therapy, and remembering hormone therapy does have a major impact on fertility, then you might not have the option of fertility preservation before you start hormone therapy, because fertility preservation involves freezing sperm and ova. And if you've started puberty blockers really early in puberty, you might not have sperm and ova available to freeze.
Okay.
So that's really important to take all of this into account when medical teams are deciding on the timing of starting and stopping puberty blockers. And then another factor is that there's certain types of gender-affirming surgery that need a certain level of genital growth before they're possible. So puberty blockers might not be the right choice for a young trans person who wants to have an option of one of these kinds of specific gender-affirming surgeries in future when they're adults.
And these are the kinds of conversations that they'd be having with their parent and with the medical team, early on before they start doing anything, so they can make this, informed choice.
Absolutely. This is the whole process of any medical intervention with a child involves weighing up the risks and benefits and deciding in this particular young person's case what is the best course of action. It's also important to remember that in medical systems, those decisions are being made. Obviously, for someone under the age of 18, their parents would be involved in giving consent, but young people are also involved in making decisions about their own medical treatment. And this is not particular to trans care. Within medical systems, there's a recognition that older children, particularly teenagers, should be consulted and should have a say in their own healthcare, in line, obviously, with their age, their stage of development, and their capacity to understand the consequences of their choices. Okay. So the involvement of young people in making decisions about their own healthcare is well established, and it's generally governed by laws and policies, and there's specific guidelines in place to help healthcare providers assess, does this particular child have the capacity to make these choices?
So it's not like a new, this is not something new that's happening. People have been involved in these decisions for, years and years.
It's not new, and it's definitely not specific to trans healthcare. This is something that's a general principle in medical systems. The other thing to remember is that puberty blockers are unfortunately expensive drugs. In some countries, they are made available as part of national health services, or they're available in state healthcare systems, or they might be covered by medical aid schemes. But in many countries around the world, families actually have to pay for this treatment out of pocket. And that means that puberty blockers are unaffordable for most young trans people.
Yeah.
In fact, around the world, there's very, very small numbers of trans adolescents who actually use puberty blockers.
And I wondered if we could talk for a bit about hormone replacement therapy, and maybe if we could start by, if you could tell us a bit about what that means or what that looks like when someone's going through that.
Okay, so hormone replacement therapy is treatment with hormones, which includes estrogen, progesterone, and testosterone, to replace natural hormones where those hormones are not being produced in sufficient quantities by the body.
Okay.
So hormone replacement therapy is used in cisgender people to treat symptoms like menopause and other symptoms of low hormone levels like erectile dysfunction. But for trans and gender diverse people, they're used as part of gender-affirming care.
And so in terms of getting started using that, that's again going to be another conversation that they have, with medical professionals, social workers, with a parent or family members. That's how they get started in that kind of treatment?
Okay, so first of all, not all trans and gender diverse community members want or need hormone therapy. But for those who do, it's a really powerful medical intervention, and it allows us to develop the secondary sexual characteristics that align to our gender, and they have a profoundly positive impact. They improve mental and physical well-being, they improve overall health outcomes, and they produce better social functioning, and they just generally give us the ability to get on with living full, productive, joyful lives. But the process for starting hormone therapy for gender-affirming care really differs from country to country, and it differs from person to person. So as you've said, it's always an individual decision, and it's always made understanding the risks and the benefits. And there's no set time when a person starts hormone therapy. Some people start it in late adolescence. Most people start it in early adulthood. But some people start later in life, and I know people who've started hormone therapy in their 50s and their 60s. And there's also really different entry points in different countries, so it's impossible to generalize. Some people might receive hormone therapy from a GP, some from an endocrinologist. If you're a young person, you'll be receiving it from a multidisciplinary team, and you might be accessing it through a state or private hospital or clinic.
Okay.
And then once again, in a lot of countries around the world, hormone therapy is just not available.
So a lot of barriers to access a lot of these services in many places around the world, it sounds like.
Yeah, absolutely.
And I think there's a lot of misinformation out there about trans people not being able to have children. I wonder if you could speak to us a little bit about that.
Okay, so to start off with, to talk about hormone therapy, as we said with puberty blockers, it's not the puberty blockers themselves that would cause infertility. Puberty blockers don't cause, as an invariable consequence, long-term infertility, but hormone therapy does. So let's just rewind a bit. First of all, hormone therapy it's been used for many decades. It's generally safe and well tolerated. Hormone therapy can involve masculinizing therapy, and that uses testosterone, and can involve feminizing therapy, and that uses estrogen and sometimes progesterone.
Okay.
And these different types of therapies, depending on the different types of hormones that are being used, have different side effects. So it's going to be different. The potential side effects are going to be different if you're using testosterone as opposed to if you're using estrogen. But all of them do have potential side effects, and some of these are serious side effects. And that's why it's really important to have proper medical monitoring when you're on hormone therapy. So trans people who are on hormone therapy have regular blood tests, and the aim of this is to make sure that doctors can identify and treat any side effects as soon as possible. In terms of fertility specifically, hormone therapy definitely does have an effect on fertility. Okay. So it leads over time to a reduction in sperm and overproduction. So as you start using hormone therapy, progressively you will produce less sperm, you will produce less ova. And that's why right at the start, before you even start with gender-affirming hormone therapy, your doctor will have a long discussion with you about fertility. And fertility preservation measures are available. They involve freezing of sperm and ova, so that if you do in future want to become a biological parent, that option would be available to you. But these options are expensive, and they may or may not be covered by National Health Services. They may or may not be covered by medical schemes. So whether someone who's starting hormone therapy does do fertility preservation is, once again, it's a deeply personal decision, and it really depends on each person's specific medical needs, their specific aspiration and values in life, and their own personal circumstances. The other important thing to remember is that it does have an impact on fertility, but that impact varies. So hormone therapy is not a reliable form of contraception. So if you are on hormone therapy and there's a chance of pregnancy, then you will definitely need to use contraceptives.
Okay.
And then also, really excitingly, we've got a lot of emerging data on the fact that testosterone used for masculinizing hormone therapy is actually reversible in terms of the impact on fertility.
Wow.
And there are a growing number of documented cases where trans men have actually stopped hormone therapy and have been able to conceive and give birth to a child.
Wow.
And so in terms of the misconceptions, a lot of trans and gender diverse people do in fact have children. And actually, I am the lucky parent of 2 beautiful and brilliant kids.
Amazing.
They're now teenagers, and so I am currently being introduced to the joys of K-pop. And
Awesome.
this is one of the things that no one warns you about when you're about to become a parent, which is that Korean pop music might be a big part of your future.
Yeah. And now it's become part of yours.
Absolutely.
Have you come to enjoy listening to K-pop?
So, whether I like it or not, I listen to a lot of Stray Kids, and actually I'm beginning to appreciate it.
That's cool. I really like that. So you're getting exposed to different things now, which is really cool.
Definitely.
And I wondered, I think the last sort of section that I'd like to discuss is gender affirming surgery. And I wondered if you could outline for us what kind of gender affirming surgeries are available for people.
So in terms of gender affirming surgery, there's masculinizing surgery and there's feminizing surgery. And there's a lot of different types of surgeries that fall under each of these categories. And within those types of surgeries, there's a whole lot of different techniques.
Okay.
If we were going to go into all of the detail of gender affirming surgery, we would need a whole podcast just on its own.
Yeah.
But very, very broadly speaking, some of these are routine procedures that are offered every day in hospitals and clinics to cisgender people and transgender people.
Okay.
But some of these are very, very specialist techniques that require people with specialist expertise. And usually they're kind of broadly divided into 2 terms based on the areas of the body that are involved. So you'll hear people talk about top surgery, and that involves either mastectomy or breast augmentation, or bottom surgery, which involves procedures on the genitals. But as I said, there's so many different types of surgeries that could be considered gender affirming, including, for example, facial surgery.
And what, in terms of the age that people are able to access these kinds of surgeries, what does that tend to look like?
So first of all, in terms of age, most people access gender affirming surgery over the age of 18. There might be a few cases based on specific individual circumstances where an older teen in the age range of maybe 16 or 17 years old might have received some form of gender affirming surgery, but these are rarely exceptional cases. In general, it's people over the age of 18, sometimes due to legal requirements, but also because often there's a level of physical development that's needed before these surgeries are possible.
And in terms of like the criteria that has to be met for someone to be able to access this, what does that criteria look like? I mean, I would imagine it probably, does it differ from place to place, or is it pretty consistent around the world?
No. So it really very, very much differs from place to place. It also differs depending on the different types of surgery that are involved. In general, around the world, top surgery is usually more accessible. And in lots of places around the world, bottom surgery might not be available at all, or there might be very, very long waiting lists. So in some countries, there's a requirement to first have a series of psychological assessments, but in other countries, the surgeon actually does that assessment themselves, and they will assess the person's mental capacity to be able to give informed consent, and that will be part of the informed consent process where they explain the risks and the benefits, and the person is then being able to make that decision. But having a multidisciplinary team and really good pre and post-operative care are associated with having better outcomes. It's also important to remember that there's a lot of misinformation about people having gender-affirming surgery at young ages. That doesn't happen. And there's a lot of misinformation about people having gender-affirming surgery and then having a lot of regrets about that. There are a few isolated cases of individuals who've regretted gender-affirming surgery, and these have been given a huge amount of medical attention. But these are really the exception. And when you look at the actual scientific research, it shows that an average of 1% of people who undergo gender-affirming surgery procedures actually regret them. And that's far, far lower levels of regret than regret levels for other forms of surgery, like knee surgery or even heart surgery.
I think it's really important to be able to put it into perspective that way, because I think often in the media, certain statistics or data is highlighted and so it's presented like, oh my gosh, look at this. But if you actually look at it comparatively, like you've just mentioned, it's, it's not the way it's being presented,
Yeah, so the studies that have been done show levels of regret at average being 1%, whereas levels of regret for something like knee surgery are at around 40%.
Wow.
So really gender-affirming care gender-affirming surgery is one of the forms of surgery with the lowest levels of regret. I mean, the other misinformation that's out there is that doctors go around doing gender-affirming surgery to young children. And I can't say this clearly enough. Doctors do not go around handing out gender-affirming surgery to young children. So, as I've said, there have been a few cases where older teens have undergone gender-affirming surgery. And in these cases, like any other form of gender-affirming care, they would have been in the care of a multidisciplinary team. Their parents and guardians would have given consent for the procedures, and they would have carefully weighed up the risks and the benefits. One case that I know about because I read a book was a young trans woman in the USA, where from the age when she started talking, she started telling everyone that she was a girl. She'd been living as a girl her entire childhood. She'd then in high school been involved in a series of court cases, because she'd been discriminated against in the school system. And by the time she got to 17 years old, she really just wanted to be able to get on with living a normal life. And she said to her parents, do I really have to wait for another year to have surgery, or can I please just have surgery now and just get on with my life? And her parents in those circumstances agreed to the surgery. But as I said, it's really a minority of cases. In general, gender-affirming surgery is available to people over the age of 18. Now, it's understandable that people get upset when they hear scary misinformation about children. So it's really important to remember that there are protections in the medical system. There are guidelines that are based on scientific data. There's legal requirements that medical professionals have to follow. And there are requirements for informed consent from parents, with children being involved in decision-making at a level that's appropriate to their age and development. And here I'm not talking about gender-affirming surgery. I'm talking about vaccination. Because actually it makes no sense at all to talk about small children and gender-affirming surgery. So I'd just like to take this opportunity to make a general point and say there is a lot of misinformation out there about a lot of medical topics. So please always get your medical information from a trusted source and not from anonymous people on social media.
And just before we wrap up the podcast, I did want to end by having a conversation around different types of families and different kinds of ways that people can be parents. I think that's quite a nice way for us to conclude the podcast. And I wondered if you could speak to that a little bit for us today.
For sure. So we've been talking about reproductive healthcare options for trans and gender diverse people, but I really wanted to emphasize that whether you are trans or not, there's so many different types of families. There's many people who are trans, people who are not trans, who cannot have children or who choose not to have children. And those are valid choices. And then there are many people who choose to adopt children or who are foster parents or who are step parents. And families come in all sorts of shapes and forms. So yes, sure, there are nuclear families where you have two parents and their kids, but I also really want to give a big shout out to all the single parents out there who are doing such an amazing job raising kids on their own. And then where I come from in South Africa, extended families are really, really important. And there's a lot of children who are actually being raised by their grandparents or by their aunts and uncles. And those are also families, and they're also deserve to be respected. And one of the most beautiful stories that I've ever heard about different types of family relationships comes from Zimbabwe, where there's an organization called TERS, which is Trans and Intersex Rising Zimbabwe. And they're an advocacy organization that works towards health rights for trans and gender diverse community members. And they realized that there were a lot of young trans women in the community who had been disowned and thrown out by their families. And so they were missing that role of having a mother or a grandmother in their lives. And so the organization contacted a local pensioners organization, and they discovered that in that same community, there were a lot of elderly women who had lost their husbands and whose families might have moved away to other cities or even to other countries in search of work opportunities. And a lot of these elder women were actually very lonely. And so the two organizations got together, and they now run a joint project where the young trans woman can experience the loving care and the benefit of the advice and the wisdom of these elder women. And the elder women get company and companionship and support from the young trans woman.
That's so
and for me, this project is just a wonderful reminder that family relationships come in so many different shapes and forms, and all of them are important.
Yeah, that's so special. I think that's such a wonderful initiative. And thank you for sharing that, because I hadn't heard about that before. And I think that's such a lovely thing to know that it's existing, and also to highlight your point that families do come in all shapes and sizes, and that you can connect with someone who you don't have any biological relationship to, and they become your family. So I think that's a really lovely place for us to conclude the podcast today. And just quickly for our listeners, if they want to find out more about you and the work that you do, where should they go looking?
Okay, so first of all, I would just like to say thank you to you and to the Sex in Space team for this opportunity to share this information. And thank you to everyone who's listened to this podcast. For those of you who are listening, if you haven't reached your absolute limit for medical terminology and scientific research, we're going to be sharing some of the links for the resources that I've been referring to today. So you'll be able to access those links and look at the guidelines and the studies. If you do want to read more about GATE's work, you can go to www.gate.ngo, and you'll be able to access information through our knowledge portal. Thank you so much.
Thank you so much, Anil. It's been lovely to speak with you. We really hope you enjoyed today's episode. Before we sign off, we wanted to ask you for your help. Because we talk about sex, we keep getting shadow banned across a lot of social media platforms. And this not only makes it hard for us to be found, but it says that sex is not okay to talk about. Not only is sex okay to talk about, it's totally essential, because more knowledge equals better outcomes across a whole bunch of measures for all of us. You can make a difference, and the thing that we need from you is your active support. So please follow the podcast and sign up to our socials, Instagram, TikTok, YouTube, whichever you like. You can find us over on sexandspace.com and click on our social links from there. Help us make sex an okay space. Thank you for taking this Sex and Space trip with us. Until next time, safe travels, and we'll see you on the next intergalactic episode.